So tell me why you're here today.
Because my eyebrows are falling out from chemotherapy.
Which is not a great thing. Have you lost just some of your brows, not all of your brows so far?
Not all so far, but I keep losing more every treatment.
And so it's possible you could end up losing them all.
Yes.
So what we want to do is give you a base of color so you will have a brow there whatever happens.
Right.
Okay, now what else can you
And
tell
I
me
also-
about your brow shape that's important to you?
I don't know. I want thicker eyebrows.
Uh-huh.
And
You told me something before about the shape of your brow. What did you tell me before?
oh yeah, that a lot of it fell out here and a lot of it fell out here completely already, and it's been out for a long time. Actually, it never really came back after another chemo treatment before, years ago. And what else? Oh, I sweat off makeup on my forehead all the time, so it just gets impossible to keep putting it on. And this will be a lot easier to deal with and a lot nicer.
And you think your brows are a little high, right? By your nose.
Yeah, and I think I have a lot of space between, like my eye and my eyebrow, and so I think we need to go below rather than going up. But I'm totally trusting your judgment.
Well, I agree with you.
You're the pro.
I agree with you. I think they're a little high, especially towards your nose. They look downward slanted, which makes you look a little bit sad, and you're probably not a sad person.
No.
So
positive.
So positive is right. We want to give you brows that look much more positive. So we're going to give you more lift at your arch and bring them down a little bit towards your nose so they don't have that downward slanted look.
Great.
Alrighty. So the first thing I'm going to do is I'm going to use some removable color.
Okay.
And I'm going to paint your brows on where we want them to be. So we both agree about the shape and placement,
Wonderful.
and there won't be any confusion about that, especially because we're reshaping your brows a little bit, so I want to make sure that we agree about how we're going to reshape them.
Okay. You're the artiste.
That's the important thing. This is an artistic process, and people who do this should be artists, or they shouldn't be doing this.
My sister said to me, "Oh, there's a tattoo artist in Glencoe. He might do your eyebrows for free." I said, "Are you out of your mind?"
Most tattoo people don't know a whole lot about
Oh God,
beauty.
that would
They
be
can
disaster.
apply color, but
That would be disastrous. I was like, "No, thank you."
they're not used to doing what I'm doing, which is integrating my work with your existing features.
Mm-hmm.
That's a special study. So what I'm doing right now is I'm applying color in little hair-like strokes with a fine brush, which closely resembles what I'm going to be able to do with my tattooing process.
Okay.
And I've gone a little bit underneath your brow hairs by your nose to fill in where the color seems to have been lost. And I'm raising your arch just a little bit.
Yeah, and there's chunks missing. Like they don't start where they should.
Mm-hmm.
You know.
Yeah, so I brought it a little closer to your nose.
Okay.
The good thing about this is by doing it this way, if your brows fall out, which is entirely possible, of course, with the chemo process, then first of all, you'll still look like you have brows. But secondly, when your brows grow back in, they're going to grow back in, if they grow back in the same place, they'll grow back in the same way, and you won't have two sets of eyebrows. But I may recommend that you remove a few hairs that are a little bit too low towards the outside of your brow here
Okay.
to give you a little bit more lift, because they sit on the brow bone, and the hairs really should be on the crest or the highest part of the brow bone.
I'm sorry, they kind of curve down, and
Yeah,
that
yours
doesn't
are
look so good either.
a little low, but once I fix the inner or the medial end of your brow, I think you're going to find that they look better than you think they do on the outside.
Okay.
Anybody who does permanent makeup for a living should be able to take temporary color like this and do a close simulation of what they intend to do. If they can't do that, they are probably in the wrong business.
Yeah, I had been given the name of someone else when I called the salon, and it just sounded kind of squirrely, and then I was like, I think I should try med spas. So then I went online and started searching.
Well, I like working in a medical spa environment because there is that certain level of comfort for clients. I'm affiliated with a major physician.
Yeah, and then you have such a great reputation.
Well, that's not because I work in a med spa, but thank you. It's because
you're good.
It's because I am who I am. Thank you very much.
So, I didn't have to worry then.
It is your face, and who you choose to play with your face is a big thing.
Mm-hmm.
So even though the brows will be stronger when you walk out the door today, what I'm doing now is simulating more the way they're going to look after they heal.
Okay.
So they'll be a little stronger when you leave, but this is sort of what they look like a month from now. Say that again?
Very exciting.
Okay. So now I've drawn your brows on. Look in the mirror. I've drawn your brows on the way I'm going to end up doing them. This is a simulation of how they should look after about a month. So I've raised the arch of your brow here.
Mm-hmm.
So now it's a nice upward slope instead of a downward slope, which is what would make me look sad. And we're going to remove some of these hairs here that are sitting too low on the brow bone that pull your brow down.
Okay.
The highest part of the arch now is where it should be. If you do a line from the center of your mouth to the center of your eye, that's where the highest part of the arch should be. So it's in the right place. I brought your brow in a little closer to your nose. I filled in this area. And if and when you do lose your brow hairs, except that you'll have to keep these.
Yeah, maybe this one's a little shorter than this one, or.
Well, we'll worry about that when we're tattooing.
For real.
But if and when you do lose your brow hairs, then you'll look like you have eyebrows. And if they grow back, except for these hairs, which you want to keep out of there, you'll know what to tweeze. Exactly.
Perfect.
Alrighty.
Yay.
Now let's do it for real.
Okay.
Alright, so now you should be numbed up enough. I have your brows sketched on for a guideline, and I'm going to use the hand tool for this procedure. This is what's called microblading or 3D brows or feathering brows. You may have heard about that. I actually combine two different methods when I work. I use the microblading method, which creates little fine slits in your skin that the pigment flows into, and what's called the soft tap method, which lifts little tiny flaps in the surface of your skin and reinforces it. So some people train with one or the other. I happen to like both of them together. And sometimes I'll use the hand tool, sometimes I'll use the machine, but the main reason for the hand tool is it makes really fine lines, and it doesn't involve as much blood and lymph and immune response, so especially for someone who's got immune issues, it seems to be a better choice.
Great.
So that's what we're going to do. And I use multiple colors. So I usually start a little lighter, and then I'll go darker as we go along. And I'm going to erase my guidelines selectively so that I don't lose my pattern. Does that feel okay?
Oh, yes.
Good. So this is making little tiny micro slits in your skin that the color flows into. And I apply it in the direction of natural hair growth. Now, some people like very distinct hair strokes that are widely spaced with skin between them. I find most of my clients like something that's a little bit more like a powdered shadow effect with hair strokes in front of it.
Mm-hmm.
So I usually do this in a way that puts a little lighter color background with a little darker hair stroke in the foreground by the time I'm done. And after I've done an area, then I wipe you with another liquid anesthetic. So while it's good that you're comfortable now, that keeps you from becoming uncomfortable while we're working. And there is a little bit of bleeding during the process, but again, that other liquid anesthetic, just like my Predender, contains epinephrine. And epinephrine shuts down the little surface capillaries,
Oh, good. Okay.
so you don't get really bloody.
Yeah, I know, because the chemotherapy sort of creates that problem.
Yeah. You are hardly bleeding at all here during this process, which is good. We are almost done. They are looking fabulous. Just reinforcing a couple of the hairs.
Didn't hurt.
That's what we like to hear. I'm going to use my low-level laser. This is a red light that speeds healing and reduces any pain and redness and inflammation. However, in your particular case, and this is often the case with the hand tool, there really is very little in the way of any of that, especially because we used the epinephrine-enhanced anesthetics. There was very little bleeding. You don't see any redness. You're not puffy. You're not too dark. What I like to do is send you out looking perfect. And then when you heal, you're going to lose about 30% of the color from the surface of your skin. And you'll only be 70% of perfect in a month. So you'll come back in a month and we'll reinforce the faded hair selectively as needed.
Great.
And then you will be all good to go.
Wow!
We like wow.
Beautiful! Perfect, perfect, perfect.
Oh, we look nice. So now, no one knows except you and I that we did this. If we zoom in really close, we can see that these brows have a real natural hair-like appearance, so that the world will just think you have nice brows. That's the point of the exercise. If you feel good, then we did the right thing.
I am so thrilled.
Got brows.
Beautiful.
So it wasn't painful, it was all good.
Didn't feel a thing.
So what would you have to say to people who are afraid of doing this process?
Crazy to waste your time. Do it. Don't wait.
But come to me.
Come to Jeff, because he knows what he's doing.